Hey everybody, welcome to another wellness webinar. This is Derek coming to you from the LuckyVitamin corporate headquarters in beautiful Conshohocken, Pennsylvania, just outside Philadelphia. It's great to have so many people joining us today for the LuckyVitamin Wellness webinar about the many benefits of iron presented by our friends at Flora. Thank you all very much for attending. Today we are joined by Dr. Kathy Carlson-Rink. Dr. Carlson-Rink is a licensed naturopathic physician and registered midwife in general family practice with a focus on pregnancy and women's and children's health. She completed her Doctor of Naturopathic Medicine with a postgraduate specialization in midwifery at Bastyr University in Seattle, Washington. She was the first naturopathic physician also practicing as a midwife in Canada. She is currently a member of the British Columbia Naturopathic Association, the College of Naturopathic Physicians of BC, and the Canadian Naturopathic Association. She is also an instructor at the Boucher Institute of Naturopathic Medicine and provides continuing education for healthcare providers in natural treatments in the areas of obstetrics and pediatrics. Before we begin our webinar, just a few quick reminders. This webinar is being recorded and will be emailed to you after its conclusion. If you have any questions during today's webinar, please enter them into the question box on your screen. Also, please stay tuned for a special offer from LuckyVitamin on Flora products at the end of the webinar. Thank you all again, and I'm going to turn this over to Dr. Kathy now. Doctor, take it away.
Thank you very much. So today we're going to be talking about iron deficiency, and this is a very common deficiency, particularly in women and children. It's also a very preventable deficiency and a very treatable one, and it shouldn't be missed. There's a lot of people that are complaining of fatigue, which is one of the main symptoms of iron deficiency, and you don't want to get really complicated before you've considered this, because it's very easy to resolve, and people shouldn't be going around exhausted because of it. So this is a solution that affects 4 out of 5 women in the world. Iron deficiency can be prevented for 4 out of 5 women in the world. So some of the symptoms are too exhausted to get off the couch. So going to get the remote control seems like work. You feel like you're living in a fog. You have a really hard time concentrating. Iron deficiency also affects the immune system. So someone who comes in and says, I'm exhausted all the time, I seem to catch everything in my office, that's a big red flag. Hard time completing tasks, so it can be mental or physical tasks. Everything seems like just everything looks like a mountain instead of a small hill in terms of a task to complete. You often have a really difficult time exercising. You may get chest pains or heart palpitations while you're exercising, and you just feel depleted after you have exercised. Iron affects the thyroid gland, so you can have people complaining of easy weight gain or cold hands and feet. And of course, iron gives blood its nice red color, and so you'll see a lot of paleness with iron deficiency. So dark circles under your eyes. If you bring your eyelids down, they'll look pale underneath. Your nail beds can look pale. And even your lifelines, they should be darker than the rest of your palm, but if they're the same color, that's also a sign. Hair loss is very common with iron deficiency. When a woman comes in and says to me, I'm losing my hair, the first thing we're going to rule out is iron and the other nutrients, B12. And they'll also complain that their hair doesn't feel healthy. It does affect sleep, so people sometimes complain of difficulty sleeping. And again, anything with exertion, so going up a flight of stairs, you might feel dizzy, you might get heart palpitations, so that's the things to look for. And a lot of women think, oh, well, I burn the candle at both ends. I'm a mom. I have a job. This is why I'm tired. And my big issue with this is we're going to go over some of the health issues, but it's also a quality of life issue, that we have women going around exhausted that don't need to be. So this is the #1 deficiency in the world. And we know that it affects both women and children. And I'll talk a little bit later why it doesn't affect men as often. There is some male populations that it does affect, and I'll go over that, excuse me, but it's mostly women and children. It is the leading cause of fatigue in women. And this is a really important point. It's the only nutrient that's still significantly prevalent in industrial countries. And what that means is that, yes, we see other nutrient deficiencies, but they're subclinical. This is still an overt deficiency that we see in the Western world. 1 out of 5 women start their pregnancies without enough of iron, and we'll talk about preconceptually. And this is a really important thing. It's often missed on routine physicals and blood work. I can say I've been lecturing about iron deficiency for about 16 years, and I'm happy to say that I'm seeing better blood work now run on women, so it's not missed as often. So it's refreshing to see that change. But I'm still seeing women coming in saying, you know, I've gone to my doctor, I've had my full physical, they've done routine blood work, they found nothing wrong with me, yet they're crawling into my office. And then when we do more extensive blood work, checking their iron stores, we find out, yes, they're iron deficient. As soon as we give them iron, they feel better, and they think something's terribly wrong with them. This is a really important slide. From the first period to the last period, the status of this nutrient is determined by your menstrual period and pregnancy. And this is why it's so much more common in women than men, because we lose iron every month with our menstrual flow. And then the demands of pregnancy actually double the amount you need. So if you're non-pregnant, you need 15 milligrams. When you're pregnant, you actually need 30 milligrams. Yet you only go up about 300 calories. So you've got to double your iron with only 300 calories more. So there's a real challenge. And so, for example, if you have a heavy period, you're going to lose more iron every month, and that's going to put you at more risk. And so we see women in menopause sometimes deal with iron deficiency, but it's less common. But some women who've had really heavy periods go into menopause iron deficient, and sometimes there's where it's missed as well. So I want to talk about this study that was done. This was done in Great Britain, and it took women between ages 18 and 55 that complained of unexplained fatigue. And what they did is they did standard blood work on them, full physicals, and they found nothing wrong with them. And then they decided to look at their iron stores, which is a test called serum ferritin. And what they found is that over half the women in the study were low in iron. And if they took the women that were borderline, it was about 2/3. So they were in the low normal range. And this study concluded this was one of the most underdiagnosed causes of fatigue in childbearing women. So let's talk about the impact. So we know that about 2 billion people in the world struggle with anemia, and that iron is the main cause. And in developing countries, this is a significant problem because it actually affects their ability to work, and it affects whole populations. So, you know, when you're already struggling and then you have this incapacity to work, it's a real problem. And for those women who and men who've struggled with iron deficiency, you know how difficult it is to get work done when you're iron deficient. So this is just a map from the World Health Organization that goes over the level of iron deficiency or anemia around the world. And what I want you to note is, so white is normal. So you can see that there is no place in the world that we don't see iron deficiency. Now in the Western world, you look at Europe, North America, Australia, New Zealand, you can see that it's mild. And then once we get into developing countries, it's much, much more significant. But the point of this slide is that nobody's untouched by iron deficiency. Now the next slide I'm going to show you is pregnancy, and what I want you to see is how much more prevalent it becomes once a woman's pregnant. And this is important because even if you've said, well, I've had my babies, what you don't realize is the demands of pregnancy that can actually end up why you're iron deficient even 2 years later. And so that poor treatment of the iron, getting enough iron during pregnancy, can impact you for years after. Okay, so why do you need iron? Why is it important? So it's needed for cellular energy. So what that means is it's needed for the fuel of every cell, and it's needed for a fuel called ATP. And so that's why fatigue is a symptom before you become anemic. So once your iron stores are low, then you'll start to feel fatigue. It's also needed for detoxification, particularly for lead and cadmium. So they found that people that are iron deficient tend to store more of these nutrients. The main source of cadmium is smoking and exhaust fumes from cars. So the other thing it's important for is thyroid function. So your thyroid won't optimally function if you don't have enough iron present. For people who are already on thyroid medications and then they realize that they might be low in iron, you may need to, once you start iron, you may need to adjust your dose of your thyroid medication. So we often recommend it gets checked a month later. It also affects heart function. It's primarily heart arrhythmia. So that means that heart palpitations. So they're making sure the rhythm of the heart is normal. And so that's why you see heart racing as a symptom. And this again happens before you become anemic. What's anemic? That's a low red blood cell count. So most people know that iron's needed to make red blood cells. You need 4 irons per red blood cell. And it becomes part of something called hemoglobin. And its job is to carry oxygen around the body. So again, your fatigue's going to get even worse if you've got a low red blood cell count because you can't get all the oxygen delivered around your body. And a lot of people are unaware that it's needed to make estrogen and progesterone, and that's why it's been linked with unexplained infertility. So why do you need it for pregnancy? So you need it for your placenta development. And there's many diseases that are linked in complications in pregnancy that are linked with poor placenta development. And the issue is that it's best that you have it on preconception. So I often start women on a low-dose iron at least 3 months before they conceive. About 50% of pregnancies are unplanned, and that's why I'm a big fan of low-dose preventative iron for women in their childbearing years, which we'll get a bit more into. We know that we need it we go up about 20 to 30% more red blood cells to help get oxygen to the baby. So you just need to make more red blood cells, so that means you need more iron as part of them. It's needed for the baby's brain development. And this is particularly after 28 weeks of pregnancy. And it's also needed to lay down the iron stores for the first 6 months of life for the baby. So if you don't have enough iron, they may not get as much iron stores, and that affects their development once they're out of mom's tummy. So what happens if you become iron deficient? So we'll go through some of the complications. So let's first talk about children. A lot of research done on children. To give you an idea why it's so common, from 6 months of age on, you need 10 milligrams of iron a day for children, and that's the same dose as an adult male. Why do you need so much iron? Anytime the body is growing, it's going to be making new tissue, it's going to be making new red blood cells, so it needs iron on board for that. 0 to 4 is the most rapid period of growth in a person's life. And so what we see is developmental delays. So not walking on time, not talking on time, for example. And we don't know if these developmental delays are actually reversible or irreversible. And that's why we've had recommendations coming out that we consider giving 10 milligrams of iron for children between ages 1 and 2, a crucial time of the brain development. We've also seen it a lot with behavioral problems, and that those who have children in the audience know that when children are fatigued, they don't lay on the couch like we do. They just get really irritable. And so that's why it's an area to address. We've had multiple studies now linking it with a higher rate of attention deficit disorder. Does that mean iron is the cause of it? Absolutely not. Absolutely not. This is a multifactorial disease. But what they found is, in research, when they check with children already diagnosed with attention deficit disorder, a significant amount of them are iron deficient. Why that's important is that, remember, hard time concentrating, hard time focusing is one of the main symptoms of iron deficiency. So if you help with that, that also should improve their symptoms. Many, many studies done on learning difficulties both with children and adolescents, and what they found is those children that are low in iron, if they're given iron, they improve their academic performance. And then it's been linked with chronic ear infections. Remember I talked about the fact that it's needed for the immune system. So what they found is for children that are chronically getting sick that we should be looking at if iron is an issue. So for pregnancy, we see low birth weight babies, and that's to do with the placenta development. Linked with preterm labor, postpartum depression. Those, having someone who spends a lot of time with postpartum women, you're sleep deprived, you just run a marathon or a sprint depending on your labor, but you've still got this recovery time. You're up every few hours with your baby, and you're still recovering from the childbirth, and then you add extra fatigue that's not necessary, then you're going to make depression worse. We've talked about poor placenta development, and this is a really crucial one because I see this a lot. An increased risk with every pregnancy if it wasn't adequately treated. I remember I had a woman coming in for her 6th baby. This is the first time I was taking care of her, and she was absolutely wiped. And when we checked her iron stores, her hemoglobin was normal. She was completely depleted. She was actually at absent iron stores. As soon as we treated that, she started feeling better. And my guess is previous pregnancies, because they were only checking the hemoglobin, they didn't realize how deficient she'd become. So this is a very new study out that shows that low intake, this is a population study, so we can't say it's cause and effect, but what they found is that women who had low iron intake in pregnancy, they found their children had cognitive delays up to age 2 and a higher diagnosis of autism. So remember, one of the roles in pregnancy is for brain development. So this is an interesting development. It's also been linked with miscarriage and infertility. And miscarriage because, remember, it's needed to make progesterone, which helps maintain the pregnancy. So what they found is iron stores, anything below 40 is linked with unexplained infertility and miscarriage. So women, they've actually found a higher rate of PMS when women are iron deficient, depression, and decreased fertility. And the big one I've talked about, fatigue, and then quality of life. So there's some issues around supplementing iron. The first is iron overload, which I'm sure you guys have heard a lot about. So I want to actually help you understand how someone can get into iron overload and how to never, in a health food store setting, set somebody up for that. We see more complications with pregnancy if they get too much. So this is a very interesting nutrient. It's not like vitamin C where it's one of these things that you can take a lot of and take it safely. Iron's a nutrient where too little is not good, but too much isn't good either. So you want to strike that balance. And then one of the things we see is poor compliance. I've had people say to me, I don't care if I'm iron deficient, I can't stand the digestive side effects. I'll live with the fatigue. So we want to make sure that they're taking something that they can take and feel good on. So again, I've emphasized this balance that needs to be struck, and that's how we want to look at how can we prevent this really significant problem but not cause any harm. So let's talk about iron overload. This is research that was done primarily in Finland, looking at men and looking at their red meat consumption. And they found that men who had a high red meat consumption had a higher overload, and iron overload, and that was linked with heart disease. So I'm going to talk a bit about that. I actually was an exchange student in Finland, so I'm very, they love their sausage, I can say. So it was an interesting population to study. So heme iron's from an animal source. So it actually has to be from flesh. And heme iron comes into the digestive tract, the small intestine, and then it can be absorbed directly into the bloodstream. And so there really isn't any way to turn off its absorption. I have a patient who loves to eat those huge big meat plates, and his iron stores are like 800. I've had to say no more because there is no shut-off mechanism. You'll just keep absorbing iron when you have it from a flesh source. So what this shows is now the body has enough iron, but the absorption is still occurring. So when you're deficient, you absorb at a rate around 35%, and when you have enough, you still absorb at a rate of 20%. So that the really important message is that you shouldn't excessively consume meat. That doesn't mean you can't have any, but not excessively consume it. And also, you should not ever supplement with heme iron for prevention. There's times where we can use heme iron when someone's had a big bleed and we really need to bring up their hemoglobin fast, but that would probably be the only time I would use heme iron as a supplement. So what are some of the other issues? So what we've seen is that higher rates, that more than 50 milligrams a day of elemental iron is linked with high blood pressure in pregnancy, preterm labor, free radical damage, low birth weights, and constipation. And remember I said that iron deficiency causes preterm labor and low birth weights, and too much also causes them. So that's where we want to really strike that balance. So some things about iron deficiency. You can't correct it with diet alone. It's very challenging. Part of it is that you only get about 2 to 10% absorption from iron in your diet. The average person gets about 10 milligrams of iron in their diet. So a man needs 10, so he's almost always okay. A woman needs 15, so she's kind of always behind. So then we have to do a catch-up when it's got too low. And so you need at least 30 milligrams of elemental iron, and that's very challenging to get from the diet. Okay. So I'm going to talk about this research. This is research done in Denmark. And what they found is that if women took 20 milligrams of iron, 4 out of 5 deficiencies would be prevented. So that's an amazing thing, that we could, this big problem around the world, if we just gave women 20 milligrams of iron a day, we'd be fine. And the interesting thing is that Floradix, which has been around since the 1950s, that's the dose they've always recommended, even prior to this study coming out. So you're safe in a lower dose, and you're also safe when it's plant-based. So I'm going to explain why the non-heme iron has a safety component and why staying at a lower dose is safer. So non-heme iron requires it getting on a carrier. It requires a carrier to get it from the small intestine into the blood, and it's called transferrin. And so the way I describe it is it has to get on a boat. So now you know that I'm a Canadian when you hear me say boat. So it has to get on a boat to travel across to the bloodstream. And when you actually have enough iron storage, your hemoglobin's normal, there's this shut-off mechanism that says, I don't need any more iron. So when you are deficient, you'll absorb at a rate of 20%, but when you have enough, the absorption rate goes down to 2 to 3%. And that's the protective mechanism of plant-based iron. So there's been no link in research with plant-based iron and iron overload. And in fact, one of the studies done with the Nurses' Health Study, they found women who took iron-based supplements were much less likely to have a problem with ovulating regularly and with infertility. And this was found with plant-based iron supplements. They did not find the link with heme iron. So this is just a schematic of that shows that the non-heme iron has to get on a boat to cross the bloodstream. And then once the body has enough iron, it's going to not pick anything up on the boat, and that is the protective mechanism. The next slide I'm going to show you is a study that was done over 15 years of women taking iron. And what they found, and you can see this plateau effect, that once your body has enough, then you'll just plateau at that iron store. This is also showing you that you're better safely staying with a low dose for prevention, because if you take too much, you can actually push the absorption and end up with too much iron stored. So low dose and plant-based, and you're safe. Now, the other thing, one other comment I want to say about iron overload, so remember the big thing is it's linked with heart disease. They've also found iron deficiency is also linked with heart disease, because remember all those arrhythmias that it can cause, but it's also been found to be a powerful predictor of death of all causes for the geriatric population. And so again, we don't want to have seniors, and this is a place where you actually see a lot of iron deficiency. About 30% of seniors are iron deficient, and that's why? Poor absorption. They often don't have great teeth. Their digestive enzymes go down as they age. They don't eat as well. They eat a smaller amount. And so they often end up deficient, and then hard time exercising. So a senior, groceries, that's exhausting for them. So what they found is in research, those seniors that do not become anemic live on their own much longer than those that are deficient. And the reason they think that is because they become more dependent on others, because their cognitive, remember, hard time focusing, their cognitive ability declines, and their ability to physically take care of themselves declines. So now we're just going to talk a little bit about the Salus line of liquid tonics that Floradix is part of. These are tonics that are made in Germany. The company has been around for it's their 100th year anniversary this year, originally founded by a naturopathic physician. So some of the unique things about these liquid tonics, and this is true of Floradix and their other tonics like the calcium magnesium, they don't require any breakdown by the digestive tract, so the active ingredients are ready for absorption. And if you remember, think about how much liquid you take versus the size of a capsule. So you're taking a larger amount, and that means it can spread over more absorption sites, so that enhances its absorption. It's very easy to take for children. Children also have lower digestive enzymes, the elderly, which I've discussed, and those with digestive problems, which I can say is epidemic in North America. It's rare for me to see a patient who doesn't have some type of digestive issues. They only use nutrients that are water soluble. This is incredibly important because you actually have to put nutrients in that can stay dissolved in the liquid, else you don't have the advantages of a liquid. If you just put things in that just end up precipitating to the bottom, that's not much different than taking a capsule. And the way I explain it to people is that if you take iced tea mix, which is a really good example of something I wouldn't recommend, gut filler, if you put a teaspoon in 8 ounces of water, it all dissolves. It's still a liquid. But if you dump half the can in, you just have all this solid sitting in liquid. So what we want is the nutrients dissolved in the water, so they stay in the water, so you get the advantage of it being a liquid. All the tonics have herbs and food in them to enhance the digestion, the ability to absorb the nutrients. And all of the tonics have what we call bitter herbs in them, and that's to stimulate your digestion. And that's considered what we call the European tonic is a bitter. So every formula has some bitter herbs in it to enhance your own digestion. All of the products are made with organically grown and ethically well-crafted herbs. And one thing I don't have written down here, but these herbs are steeped for 24 hours, which means you get all the nutrients from the herbs in too. And we often use a lot of very nutritive herbs in the formulas, so you get some extra nutrition there as well. And they're all vegetarian friendly formulas. They're free of preservatives, additives, artificial color and sweeteners, GMO ingredients, pesticides, residues, radiation, and heavy metals. Every batch is tested. And so the assurance that this is a clean product, and that's very important, especially when you're using it for children, because we've never established what pesticide residues a child can handle. The reason they don't have to put any preservatives in it is that they bottle in germ-free air. They used glass bottles. And that's important because it doesn't matter how inert a plastic is, some will still come into the product. They're certified kosher, and they're made with European pharmaceutical standards. So I just want to talk about a little bit about the research on liquid iron. So we know from research that you absorb iron at best at about 10 to 15 milligrams at a time. So one of the advantages of using a liquid is you can divide the dose so you can get the maximum absorption. Most pills have 30 milligrams minimum in the pill. And so therefore, lots of this just stay in your digestive tract, and that's why you're getting constipation. If people complain of constipation with the supplement, either it's not being absorbed or they're taking too much at once. This was a study on pregnant women taking iron gluconate, liquid iron gluconate, which is the form of iron we use in Floradix, and they found that they were able to take about half the iron and have just as effective a treatment for iron deficiency. And that's been my experience too, that when I use liquids, I use about half the amount with the same therapeutic effect. So this is Floradix Iron and Herbs, which I'm sure you're familiar with on your shelves. So this was a study done in 2002 on Floradix, and they took women between ages 18 and 65 who were iron deficient but not anemic. So they had the low iron stores and the low serum ferritin. And they found that Floradix was effective at returning into normal iron stores over the 16-week period. So one group got just increase your iron-rich foods, you're just a little bit low in iron. The other one got improve your iron-rich foods plus Floradix. Why this is important is that I do see that recommendation come out. Oh, well, you're just a little bit low, just increase your iron-rich foods. And then these people get more and more fatigued because we didn't actually give them enough iron to bring their iron stores back up. So people were asked to rate how they felt, good or very good, after the study. And 70% of people felt very good or good after taking Floradix, which I have a good clinical experience with, that people start feeling good right away. Often it takes about 3 months to reestablish your iron stores for people really depleted, sometimes 6 months to a year, but they usually start feeling much better right away, versus only 28% in the control group. And this is a really important piece, the last one. 90%, 98%, 90% of people were able to take it without any side effects, including constipation. So this is just a graph of basically the iron stores stayed unchanged or got a little bit worse in the control group, and iron stores continue to go up in the Floradix group. You start to see a bit of plateauing, and that's to do with that feedback mechanism on plant-based iron. Okay, so I'm going to talk a little bit about how I use Floradix. I've been in practice for 20 years, and I have used it my whole career. If you deal with a pregnancy population, you realize that constipating a pregnant woman is not a good idea. So you soon find products that work. I've also personally taken this product since I was 14 years old, so I've had a lifelong love affair with this product. So it's been designed for prevention and mild deficiencies. You can use it I have used it for significant anemia, but you have to then go up to 4 tablespoons to do that. You need to be at 60 milligrams. It's non-constipating. It's unique that it's ferrous gluconate or iron gluconate that's fed to brewer's yeast, so it becomes actually part of the brewer's yeast, and that enhances its absorption by 2 to 3%. So the absorption of this product is around 20 to 25%. Remember, food is only 2 to 10%. There's herbs rich in iron that have spinach, nettles, and kelp, and of course the kelp helps with your thyroid. There's cofactors for iron absorption: rose hips, vitamin C, B12, and fruit juice. Fruit juice, as you know, we often suggest people take it with juice, so this is already in the product. Cofactors B12 and B6 help make red blood cells. It's plant-based, and of course there is digestive herbs to aid its absorption. I use it for prevention of iron deficiency. Remember the 20 milligrams for childbearing women. I use it for mild iron deficiency and anemia. Heavy periods, women who have heavy periods are going to become iron deficient. So those women I actually use 2 tablespoons or 30 milligrams. People that have digestive problems that are linked with bleeding. And this is a really good iron to use with people who have things like irritable bowel, because they actually can tolerate this product, but they often become deficient because of their digestive problems. I've used this for a lot of athletes, particularly endurance athletes or people that play contact sports. Those are the 2 that are at most risk. Endurance athletes because they're losing it through sweat, contact sports because they're losing it with bruising and that type of thing. And this is a place that I do treat men, and I do find iron deficiencies as well. So pregnancy, we've talked about 30 milligrams a day. I use it for 6 weeks postpartum to recover from blood loss. What they found is if a woman's adequately treated during her pregnancy, her iron stores will return to normal at 6 months. If she wasn't treated adequately, it'll take 2 years to recover. Postpartum depression we've talked about. Depression where there is low iron, that makes it worse. Infertility, and I use it for developmental delays in infants over 12 months of age. So just to go over some of the dosing. So children, infants, you do it by their body weight. 6 months to 10 years, it's 10 milligrams. Adolescent males, it's 12 milligrams. This is also a place where I often will see boys. I remember a case of a boy that I treated for, who's now just finished his master's degree, but I treated him when he was about 9 for focus issues at school. And I actually initially treated him with B6 and magnesium and essential fatty acids, and then she came in a couple of years later. She says, he's been stable for so long, and now all of a sudden he's not concentrating again. And I said, well, what else is going on? And she said, well, he can't. So he would have been about 11 or 12 at this point. Can't concentrate. He's totally playing out at hockey. Every time he's at the hockey practice, he doesn't seem to be able to get through it. So then we checked his iron levels. They were low. We gave him iron. His symptoms resolved. Adolescent females, their demands go up to 15 to 18 milligrams, and that's true for adult women too. So one of the other challenges with adolescents is that they're active or should be active. They're growing, and this is also a time where they tend to eat a lot of gut filler. And so their diet's not as good. Certainly I've got some very health conscious teenagers, but there's others that I'm negotiating where I'm like, can you just not eat at a fast food restaurant twice in a week? Like, is that a reasonable compromise? So that's a more challenging population, doesn't understand a lot of cause and effect in terms of their behavior. And then adult men or adults greater than 50 need 10 milligrams a day. So if you're a woman and you're over 50, you're generally okay with 10. Pregnant women need 30. If you're mildly anemic, you need 30 milligrams. If you're severely anemic, you need 60. Okay, so we know that 1 in 4 North American women are iron deficient. Only 20% of women start their pregnancy with enough iron. Symptoms are recognizable. It's easily corrected. And if we give 20 milligrams of iron, 4 out of 5 women will have this completely prevented. And also just a reminder, this is a product that has been on the market for a long time and stood the test of time. And so we know that it's been safe over the last 60 years for people to consume. And so it has a great track record. And so I think that's also an important piece. I certainly look at that when I'm prescribing a supplement. I want to know how long it's been on the market and how well it's been working. Okay, so we're going to wrap up here and now take your questions, and we'll go from there.
Okay, great. Thank you. And to be honest with you, I think you covered almost all of the questions that we had prepared for you, so that's pretty awesome. But let's just touch on a couple things that you did already mention, but it's probably good to reiterate. One of the questions is, which I know you did cover, but let's just kind of touch on it again. Is iron and herbs meant for women only, or can men also take it on a daily basis?
So men can take it on a daily basis. They just can't take more than 10 milligrams of it. So that's 2 teaspoons. They can safely take that. And, you know, there's been a lot of debate about seniors taking it. Here's the thing. You're never going to get in trouble giving a plant-based iron 10 milligrams a day to a senior. But their quality of life can dramatically improve. Remember that being iron deficient is the leading cause of death of all causes in seniors. So you want to give them a safe dose, but at over 65, you've got about 50%, and even higher, some studies show 65% of seniors, both men and women, that are deficient. So you want to make sure that you're dealing with this. So I have supplemented men higher than 10 milligrams, especially male athletes, but then I run blood work on them. And my general rule is follow the doses I've given you on the slides. And if it doesn't seem to be working, that's the time they need to see their naturopathic physician, their family physician, to get some blood work run to make sure we can go up. So for example, a senior might be significantly anemic. And so now here's the other point with seniors is that seniors have to have their iron stores checked because there's many causes of anemia in seniors, and one of them is something called anemia of chronic disease. They'll have normal ferritins or even elevated ferritins. Those are people you don't want to supplement. So my point is, if you stick with 10 milligrams, you're safe. But if they're contemplating taking more, that's when you need blood work, because I've given you the prevention doses. Does that help?
Yes. Okay, thank you. Now, I know you had already mentioned organic fruits and vegetables and farming methods. One customer is asking if the product itself is certified organic.
So the product is not certified organic, and it's a good question. The reason is they do use some wild crafting herbs, which can't be certified, so that's important to know. So Salus has its own farm. They have their own farm in Chile. It's a German company, Chile. So very good farming conditions, and they happen to have an employee who ended up marrying somebody from Chile who wanted to move there. That's really it in a nutshell. But they have this beautiful farm in Chile that is a world-leading organic farm. They have developed methods there. They're studied by universities all over the world for their methods, and they've actually been able to figure out how to grow some plants that are endangered in the wild. So they rely on ethical wildcrafting, their own farm, and then they also support farmers in developing countries to convert to organic farming that they will then purchase from. They only actually, of what they look at for purchasing, besides their farm and their own ethical wildcrafters, and all their plants are tested. Again, heavy metals, radiation. There's only one other company that I've seen that extensive testing, and that's an Australian company. And what they do is they only actually take about 10% of the plants that they actually analyze, because they want to make sure they've got optimum potency. So they go through many testing. So they first go through a cold assessment, and that's to actually kill off any bugs or worms. And then they're sorted for any like stones, that type of thing. And then they have all their different chemical analysis in the lab, and they're actually even tested with their machine to make sure they're optimally picked. So they're looking for an optimal color, and if they don't meet all that criteria, they don't receive the product. Does that help?
Okay, that does. Thank you very much. So we're talking about iron deficiency, but a customer asks, if I am not iron deficient, will I notice any significant benefits from taking an iron supplement?
Well, this particular one is designed for energy, so there is some components in it that really do help with energy. So I do get a lot of women in their menopausal years that take 10 milligrams who find that they just have way better energy when they take it, because this is an energizing formula the way it's designed. So I would say the main thing is people notice better energy.
Okay, great. Thank you. I do believe that all the other questions that were asked were covered during the presentation, so I'm going to go ahead and wrap this up now. So thank you everybody for attending, and another big thank you to Dr. Carlson Rink for all of the information. This webinar will be emailed to all registrants soon, and you can also find it by visiting LuckyVitamin.com and search keyword webinar. While you're there, check out all the other cool webinars that we have archived and also that we have coming up. Please see your screen for a special offer. Have a great day and spread the wellness.